to the cloud. Perfect. Recording in progress. Okay, so I'm going to share my screen real quick. Just going to open up our Canva slides here for all things PCOS today. And I'm really excited to be talking about this topic because PCOS is the most common disorder for women who are menstruating specifically. And it's something that Western medicine doesn't have a whole lot of answers for, oftentimes, and we'll talk about this. But the solution tends to be like maybe you go on birth control, maybe you can even do like ablations, and there's not a whole lot of good things for people experiencing PCOS. So we have in more of a functional medicine standpoint and more of an energetic standpoint. I'm sorry?
Spironolactone or whatever, like
Yeah,
really
talk about all of
anti-androgen.
those. Of
Yeah,
course.
metformin. I mean, I was like going through the list of what I was prescribed. I'm sure, we've all heard it before, but mostly, yeah, birth control, metformin, spironolactone. None of these things are good long-term solutions.
Yeah,
And,
absolutely.
or like, go on the acne medication, like trying to solve the symptom,
Yeah,
not the
Accutane. Yeah.
problem.
Yeah, of course. Everything typically in the Western medical world for PCOS is symptom management related. There's even when you look the cause, I mean, you can look up like, is there a cause for PCOS? And it's like just completely unknown, which is so wild that we're still in that place.
Right.
That is even what like the public knowledge is, because there are so many underlying causes of PCOS, even beyond what we think of as more of like the normal like blood sugar imbalancing causes, or even like stress. So there's a lot to PCOS, and I'm really excited to be talking about it today because it really makes a huge difference to know these underlying causes. So I will go ahead and share this screen. Sorry, I was just getting this open.
Screens are good.
There we go. Okay, we should be able
I see
to see
you.
this now.
Woo! Thriving Thursdays.
Thriving Thursdays, PCOS edition. Here we are. Amazing. Okay. And again, at any point, if anyone has any questions, just let me know. So what we're going to be going through today is what exactly is PCOS, how you are diagnosed with PCOS, because there's a lot of confusion around that. Conventional causes of PCOS, more root cause-based approach to PCOS, the conventional approach, and the holistic approach. So we'll go through both of them so you can kind of see the difference in what conventional medicine is telling you and what more holistic-based medicine has more options for you. So what is PCOS? PCOS, polycystic ovarian syndrome, is a woman's health disorder primarily impacting women in reproductive years. And it's primarily due to unbalanced androgens. So typically that is your testosterone that you're looking at. Most women experiencing PCOS have higher levels of testosterone. So typical symptoms that come with that are irregular base cycles. It's most common for women with PCOS to have like 35-day plus cycles. It usually tends to be on the longer end rather than the shorter end, but not necessarily true for everyone. Cystic acne is really big with PCOS. With higher levels of testosterone, the acne tends to be cystic, especially around the chin area. And I've noticed clinically, especially on the back. So women with PCOS, or if they go into swings of PCOS, which can happen when discontinuing the birth control pill as well, all of a sudden they can get acne on the back or acne on the chin that's cystic, that like deep-rooted acne in general. Excessive facial hair growth and or body hair growth. So the facial hair growth tends to be around on the lip, that like mustache-like area. And body hair growth can be any like darker hairs. It can happen around the nipples. It can happen even on like arm hair growth that people notice either like a thickening or a darkening of the hair. And then on top of that, it's like a hair thinning on the head. So it's hair where you don't want it and less hair where you do want it. And sometimes with more of the PCOS picture, it tends to be more of like a hair thinning versus like a hair balding patches. So some people notice like they run their fingers through their hair and it's just feeling a little less full than what it used to be, rather than there's one specific spot on their head that feels like it's losing clumps. Weight gain or stubborn weight loss is really, really common with PCOS. So typically women feel like they all of a sudden are just feeling, it's not, it can be weight gain specifically, but it almost just feels like puffiness or swollenness rather than this like, I've gained 10 pounds. It feels like almost like a swelling and heaviness in the body. I think those two things feel really different. And it almost feels like a water retention weight. Like there tends to be, if you like look at the skin, there tends to be like a little bit of almost like indentation that you can feel when you press in on it. So a little bit, it almost feels like stagnant lymph there as well. If you notice that feeling, but there tends to be just like a little bit more space between your skin and your muscles. And difficulty getting pregnant. So a lot of women don't even know they have PCOS until they go to get pregnant, and all of a sudden they're having a really hard time. So sometimes when women have been trying for several months, then it can potentially be investigated. Why is we having a difficult time here? Maybe an ultrasound is taken of the ovaries and then maybe they see cysts. Oftentimes when women are experiencing cycles that are around like 35 days, doctors typically aren't taking them like super seriously. It's kind of like, oh, well, it's like kind of normal. If that's like your regular, maybe that's just your regular, everyone gets acne. The symptoms are often dismissed. And
Whoa,
typically,
I'm shocked that
yeah,
a I'm so shocked that a
right.
doctor uses you. Sorry.
Of course. Just like, telling women like and Julie, I mean, you've said this so many times about perimenopause, just wait it out, And if you're not immediately looking to get pregnant, then it's fine to just wait it out. While it's really
Currently, you're waiting it out your whole life because you get PCOS at 18. You're supposed to wait that out until 42, and then you wait it out until 55 with menopause. So
yeah,
we're just supposed to be suffering or uncomfortable our whole lives, apparently.
right.
Or
Exactly.
pregnant because we're supposed to just be pregnant, right? But we can't get pregnant because of all these other issues. So
Right. Exactly. Which is just so sad. So yes, it is. It's something that it tends to be going on for a while before there's an official diagnosis. Um, So speaking of diagnosis, so with PCOS, it's a little bit complicated because you don't typically, because it's called polycystic ovarian syndrome, people think that you have to have cysts on the ovaries to have PCOS, and that is not true. Some people have cysts, some people don't, and some people with cysts don't have PCOS. So you have to have at least two of the following symptoms to be diagnosed with PCOS: your cycles, irregular or absent cycles, most cycles having 36 plus days between. So we're having that longer cycles like we talked about. Elevated testosterone. So clinical or lab finding as elevated testosterone levels. Acne. So typically cystic in nature around the chin and or jawline. Hair, excessive hair growth around the nipples and upper lip, or hair loss on the scalp. And then cysts, more than 12 follicles, 2 to 9 millimeters, or ovarian volume greater than 10 milliliters, which can be confirmed via ultrasound. So if you have irregular cycles and acne, you can potentially be diagnosed with PCOS. If you have elevated testosterone and hair loss, you can potentially be diagnosed with PCOS. So the guidelines here they're pretty vague for what women can qualify for PCOS. So it's a difficult diagnosis. And a lot of women, again, because their symptoms are often dismissed, tend to fall through those cracks of it being our symptoms are then just tolerated for a long period of time. A lot of women go underdiagnosed, and then the diagnosis is a little bit confusing going into it because it is a little bit broader in general. Hi, Kim.
Hi, sorry.
Oh my gosh, no worries at all.
hey,
I'm so glad you could make it.
the night times work better for Californians.
Yeah, I think so. I think that's true. Okay.
On last night. Fun.
Amazing.
I'm gonna cut my video.
Oh my gosh, no worries. So 22% of all women have polycystic ovaries. So this is really important because not all women who have cysts have PCOS. So if we were to take an ultrasound of all women, 22% of them would have the cyst. So it is, again, this diagnosis, it gets challenging and it gets a little bit gray. And then not all PCOS cases have cysts. So women can experience high testosterone levels, acne, and blood sugar imbalances without cysts and still have PCOS. So I want you to focus less on the cyst presence and more on the overall clinical picture, if that makes sense. So in my private practice, if people were experiencing all these symptoms of PCOS, but the ultrasound showed no cysts, like we're still acting and behaving as if this underlying causes are contributing to a PCOS picture. So conventional causes of PCOS, just one big question mark, a big unknown, and that sad face. So again, there's not a whole lot in general being studied on women's health and the exploration into why these hormonal imbalances are happening in women's bodies. And it is kind of amazing that we've gotten to this point that there's still just not a whole lot of clarity for something that is the most common reproductive disorder in women. And I think that's pretty telling about where our medical system is at for women's care.
Oh, and one of the biggest causes of, having difficulty getting pregnant
Absolutely.
and
Yeah, just going straight to IVF.
yeah, leading to fibroids, which of course was what I went through. So irritating to say the least.
Yeah, absolutely.
Guess what? We know what causes it. No,
Well, we do.
we actually do.
We do. We do know what causes it. So some root causes of PCOS, and these are things that really go far beyond the conventional medical paradigm. PCOS is really highly associated with high insulin levels. So high insulin, it causes a decrease of sex hormone binding globulin. And it's a really important marker because it binds to testosterone levels. So when we have this decreased level of sex hormone binding globulin in our bodies as women, we have testosterone that's more available in the body for use. And that means that we have this increased free testosterone that the body then is using. And this is when we start to see the symptoms like cystic acne on the chin and on the jaw, and the back acne and the hair growth, because there's just more bioavailable testosterone that shouldn't be there. An increased insulin also increases thecal cells in the ovary that can inhibit ovulation. So not only are we having more bioavailable testosterone, we're also having this insulin response that's preventing ovulation from happening. And it can even delay it, which is leading to these longer cycles, 35, 36-day plus cycles in women. So insulin is really important to consider in the PCOS picture of having balanced blood sugar. And we'll talk a little bit more about that moving forward. But a lifestyle intervention, which is great. And then stress. So higher cortisol levels produce more testosterone. When we look at the steroid hormone pathway, everything comes from cholesterol. And then when everything gets further divided down from cholesterol down the steroid hormone pathway, cortisol can either go into our cortisol bucket, or it can go into our progesterone bucket. And progesterone is the second half of our cycle, post ovulation, feeling really good, building that lining to then have a period. And if we are producing high amounts of cortisol, we're producing more testosterone and less progesterone. So if we have even that two combination of high insulin and stress, our bodies they're getting set up to not have a normal cycle. If we have under our lifestyle category, too much exercise specifically can produce excess testosterone. So if we are in the gym, and there's a really big emphasis right now in more of our exercise culture on lifting really heavy weights, and there is a time and a place for it. And if we're doing that like very, very frequently, we can build up too much testosterone potentially in the body. which for someone like PCOS, maybe like this heavy lifting strength training,
Oh, I wouldn't
very,
do it.
yeah, very frequently, it's going to be hard. It's not going to accomplish the things in your body necessarily that you're wanting to accomplish.
Well, it's
And
actually gonna do the opposite of what you want it to do.
yeah, building too much,
You're gonna
furthering the
get more
testosterone
hair,
pathway.
you're gonna retain the weight more. It's literally gonna do it's gonna get so frustrating because the more you do, the more you're gonna get not what you want.
Yeah, absolutely. Absolutely. And this is when knowing your lab markers are going to help influence the type of exercise and the type of lifestyle you need to promote what you want your body to then do. So important. Um, Blood sugar imbalances, like we talked about, inadequate sleep, which sets us up for a blood sugar roller coaster, and having cravings throughout the day to help balance those energy levels, imbalance cortisol, can all lead to increased testosterone production uh, just by influencing blood sugar and our cortisol response alone. So, adequate sleep is super, super important, making sure your body is resting and recovering and getting into that parasympathetic rest and digest state. And the gut, so gut dysbiosis, which is having an imbalanced bacteria in the gut, can contribute to hormone imbalances. There are certain strains that really promote certain hormone levels, and they're seeing that certain strains in the gut can really promote higher testosterone levels and inhibit our particularly progesterone, and even contribute to something like excess estrogen, which is really common in a PCOS picture to have higher estrogen levels as well as high testosterone. Um, our gut can also contribute to insulin resistance. So certain strains of bacteria in the gut can contribute to having difficulty with our bodies absorbing glucose and having insulin resistance. And if we're having detoxification issues as well, we have to remember that our gut, if we're having anything like a leaky gut pathology, which is a breakdown of the tight cell junctions in our intestines, they're supposed to look like this, keeping the food inside and your nutrients outside. The nutrients go through these really tight junctions to get to the rest of your body. But when our cells look like this, because the gut has been damaged, now a whole lot more things can go through the intestinal wall lining. And we have to remember that right outside of our gut is our lymphatic system. And our lymphatic system is our body's waste cleanup system. And when our gut looks like this, there's a lot more waste to clean up to go across that cell lining. And so if we're having gut dysbiosis, if we're having gut issues, our lymph system is working on overdrive and it's doing a lot of work to clean up things for us. And if we have hormone imbalances that it's trying to deal with on top of that, especially something like excess estrogen, it's going to be impaired. And that makes it hard to get hormone levels down to a normal level in your body. Does that all make sense so far? Okay, great.
Yep.
Perfect. So some more root causes continued. Toxins, which everyone knows that I'm a big fan of talking about. Phthalates, which are in a lot of personal care products, things like shampoos, soaps. Phthalates are really, really tough on hormones. They can really interfere, especially with estrogen production. BPA, which is more in the lining of cans and water bottles and cash register receipts, can be hard. And they're an estrogen mimicker as well. Heavy metals, particularly mercury and cadmium, have been found to be high in people with PCOS. Cadmium in particular is pretty tough for PCOS patients. So I always want to check in on heavy metals to see if that's a reason why maybe we're having hormone imbalances in the body, because they can be a really big cause of that. Parabens, another endocrine disruptor, and other endocrine disruptors can alter and suppress hormone function. So making sure that our houses are really clean. We'll talk a little bit more about solutions in a second. But if we're being exposed to a lot of these endocrine disrupting chemicals, especially when we're being exposed to them constantly, it can make a really big difference for how our hormone levels function. Our liver, stalled liver pathways make it more difficult to clear excess estrogen and environmental toxins. So again, if the gut's not doing super well, if we're being exposed to a lot of toxins, if we have a history of taking any medications for a long period of time, like birth control, it can be a really big cause of this. Our liver gets stuck and stalled. And so it just doesn't work as effectively as we need it to in order to get things out of our body. And that's especially true for excess estrogen. And then if all other causes have been ruled out, like the blood sugar, the toxins, your liver health, your gut health, if all of that has been addressed and things still aren't budging, there are even deeper root causes that you can look at. So things that I would examine here would be more chronic infections. Like, is there a chronic viral infection? Thinking about something like Epstein-Barr. Is there a chronic infection like Lyme that's really taxing the immune system and causing the body to be out of whack? Or is there especially a dental infection going on? Is there a history of root canals? Sometimes they can have, if the root canal has kind of gone awry, especially if it's older than 5 or 10 years. Oftentimes people can have underlying infections in the mouth that tax the immune system. So sometimes I'm thinking about that. Exposures like mold that can really tax the immune system and cause higher estrogen levels in the body, potentially. Certain strains of mold do that. And yeast overgrowths in the gut as well can potentially contribute to more of a PCOS-like picture. So if everything's kind of been ruled out, those are your like more advanced, see a specialist, rule those bigger causes out to do some advanced testing. But for the most part, with time, it typically is those other causes. If you address them, you're going to see some pretty big results.
Yeah.
So, I'm sorry, go ahead, Julie.
I'm just laughing because that seems to be they don't look at anything except go on the birth control pill. It just
I know.
it will change, I think, over time. Things do change
Well,
when more and more people ask for it to change.
absolutely. I think that's really true. I know. Well, our conventional approach right here, I mean, you have really two options. You have medications, the birth control pill, which will regulate your cycle with synthetic hormones. You're not having a period. You're having, I think a lot of people don't quite understand this, but when you're on the birth control pill, you're not having a cycle. You're having a withdrawal bleed when you stop for that week. So it isn't a true period where your body is building an endometrial lining and shedding it. Your body bleeds because it has a withdrawal from the hormones that you're taking synthetically. So it's not having a cycle. There is no brain ovarian connection there. So it is a way.
That's actually crazy, and I actually didn't really completely understand that either, by the way. So
Yeah.
I think it's
Yeah.
a thriving Thursday.
Yes, we are learning a lot on this Thriving Thursday. Yeah, it's not a period at all. It's all it is regulated by synthetic hormones. And again, you have a withdrawal from hormones, which causes the bleeding. It's why if you continue to take the pills, if you want to forego having a period on the birth control pill, it's why you're able to do that and not bleed throughout that timeline. When we think about in a normal cycle, our endometrial lining builds up over the second half of our cycle. So that then is shed during a typical period. But when we take a birth control pill, there is no like building of that lining. So when you continue to take the hormones, nothing happens. There's nothing to shed because it was never happening. So it is, yeah, when you think about it that way, it is
Crazy.
It is crazy. It is crazy. Other medications include metformin, which is more of a blood sugar regulating drug. Metformin has some interesting research on it. Some people like it for longevity. I think it's a little crazy.
I can't stand it. I mean, we can talk about that on a longevity thing. It spikes some things temporarily, but it's not a long-term play.
Yeah,
Ironic for longevity.
totally. I know it's so interesting. Some people are treating it almost like a peptide. It's a medication. I think we should just call it what it is. But it is interesting. But particularly for PCOS, it is to regulate that insulin response that tends to be more challenging for people with PCOS. But it absolutely can be done with lifestyle. It doesn't have to be with metformin. And then spirulactone, which is a diuretic, and it's helpful for acne. Again, not really looking at the cause of the acne, just more of the symptom management. And then even something, I don't think a lot of people are necessarily prescribing this that much anymore, but it still happens, is Accutane, especially for really challenging cystic acne. Accutane is really hard on your liver. It is really challenging to take even short term and temporarily. So anyone who is encouraged to take Accutane, I would be doing everything else because it's hard on your body. And then in terms of more of like a surgical approach, you can do laparoscopic ovarian drilling, which sounds just horrible. That you're almost like cauterizing out the cysts, and we have to really go to like that big of a surgical intervention before doing any kind of lifestyle intervention. It's really sad. And of course, there's a time and place when things are emergent and or really big. If there's like a very, very big cyst, of course, we have to go a surgical route, but there are many things that we can do proactively in the meantime or before it gets to that point. And then IVF, if you are having difficulty getting pregnant with PCOS. So more of a holistic based approach. So the key with PCOS is targeting it from many different areas and giving it time. So we tend to think about, when we think about addressing our health, everyone tends to think in months. We're like, okay, or I've done it for this many weeks, or I've done it for this many days. You know, I've been on this protocol for 3 months. And with PCOS, we have to remember that we're working in egg cycles. So when you have done something for a period cycle, you've been doing it for 1 cycle, you've been doing it for 2 cycles. And that's why it just is slow to change, because 1 month is real, it's just 1 cycle. And so typically I tell people, like, don't evaluate anything until like 6 months. Because again, we're working in a really different time frame and rhythm of the body. And first and foremost, is really important to regulate cortisol. So as we saw, increased cortisol can really increase that testosterone production, potentially that estrogen production, and lower progesterone. So cortisol regulating practices, which can most of them be done through lifestyle. We can get up in the morning and making sure you're making contact with the natural light. The first thing I do when I wake up in the morning is I put my feet on the ground and I open my blinds and I make sure I make direct eye contact with the sun or just the sky in general before I'm even touching my phone. That way you're improving your circadian rhythm and getting your cortisol, which is highest in the morning, regulated. Grounding practices, if you have access to a yard, are great. You know, putting your bare feet on the ground, taking a couple deep breaths. Regulating cortisol practices too, it's all about changing the reactions to our lives. So can we take a second and pause instead of going into habitual reaction? Think, is this serving me? Can I react differently here? And then sometimes people have really low cortisol. So if that's the case, knowing what you can tolerate, knowing when it's too much and you need to rest. And this is why just testing is so important, because if you're continuing to push yourself and your cortisol is low, you're going to really struggle with a lot of overwhelm. And it's not a matter of pushing through. It's a matter of you need to rest a lot more than you think you do. And then balancing blood sugar. So people with PCOS, it's really important to keep blood sugar really, really stable. And everyone's blood sugar balancing window is really different. So sometimes people can go 4 or 5 hours between meals and they feel really stable and their energy feels really grounded and they're not experiencing brain fog or anxiety or fatigue. When you start to experience those symptoms between meals, you've gone too long eating. So it does take some time to figure out what exactly your blood sugar window is. And for someone like me, mine is actually quite short. You know, for me, 4 hours is about my max. So I always have snacks on hand. You know, Julie knows this well about me, that I'm like constantly eating. But everyone is really, really different in that way. So eating a balanced diet that has adequate protein at each meal, that has a healthy serving of healthy fats, think like avocado oil, coconut oil, avocados, olives, nuts.
California,
Sorry, Julie, what'd you say?
California diet.
California diet. Yeah, so good. Yeah, California Mediterranean, all the above. Some healthy fatty fish, so good. Yeah, and lots of fiber too, to make sure fiber, especially in the brassica family. So thinking about your broccoli, your Brussels sprouts, your cauliflower, which not only are so good for your gut, but so exceptionally good for your liver, which is going to help bind to some of that excess estrogen to get it out of your body through your bowel movements. So really important. And this kind of goes hand in hand with diet optimization, but processed and packaged foods will not be your friends. Anything that is high in those seed oils like sunflower, safflower, canola, um, soybean oil, they're really tough on the body because they tend to promote more inflammation, and because PCOS is a pretty inflammatory condition in general. So anything that's going to reduce inflammation is great. Herbs and spices are particularly good, really good for that. And sugar is also not going to be your friend, largely due to the blood sugar balancing piece. And we know when we have a lot of sugar, it can change our gut microbiome. It changes our cravings and our physiology. So just really working on like a whole food primarily based diet with obviously room and flexibility for life when we want to. And exercise we talked a little bit about, but making sure like if we're doing a lot of heavy lifting, I would refrain. Things like Pilates are going to work really well. And high intensity interval training has been shown to be effective for PCOS. And it's just understand where your cortisol levels are at. If your cortisol levels are more on the lower end, you really want to be careful with doing something like HIIT. So doing it to tolerance is going to be, you have to find your tolerance window, what is going to work best for exercise.
And it's also refining it. We're refining your workout a little bit, like understanding that you can do it, but like, for example, you can go full gas at like 15, 20 seconds, but for me, it's more like 45 seconds.
Yeah.
And so a lot of it is trial and error, but a lot of it's going to come out in some of your blood work too. And a lot of it is just, like start really slowing down and paying attention to your body. Like with when I had PCOS type of stuff a long time ago, when I really just started being like, do I actually feel good eating this thing or doing this workout or whatever? And that's going to do a huge difference. I think we discount that sometimes. Like, don't try to push through it when you have an inflammatory condition.
Yes. Yes. This isn't like, I mean, it's never more pain, more gain. No, like you're going to know the difference between this works my muscles and feels good versus I'm feeling like I'm crashing after these workouts and I can't, this isn't supporting my body. So yeah, excellent points, Julie. And
Sleep. You got to talk about that.
sleep is so important. Yeah, sleep, you're going to need it to recover. And again, when your body is trying to process excess hormones, to regulate your blood sugar, to really support your body in what is an imbalanced state, you need sleep, you need rest. It's so important. So making sure that your room, Julie is so big on this and I love it, is that your room is pitch black and there's no light coming in. You know, you're keeping your phone on either out of the bedroom or on airplane mode when you sleep. And there is, I don't know if you're gonna be able to see it, but at night I turn my phone on this like red light. And so I don't look at a fluorescent light when I'm anywhere close to bedtime. So those things that can really optimize your sleep patterns are really, really important to make sure that you're getting that restful sleep as you're sleeping. Okay, so more solutions continued here. Liver health, like we talked about, is super important because it's going to help you process those the excess estrogen, particularly that's in your body. And because there tends to be, like we talked about before, this environmental exposures or heavy metals, our liver typically needs a little bit of help. So even like lifestyle-based things like dandelion tea is really good for liver health. The liver loves greens like arugula. It loves vinegar. Bitter things is the flavor in Chinese medicine for the liver. So, and that's been shown in Western medicine as well. Like vinegars, arugula, those like bitter greens are so good for liver health. So making sure your diet includes those so our liver does feel supported when it's trying to process a lot of things for us. And gut health, making sure that we're eating adequate fiber, sometimes if it's appropriate, taking your probiotic depending on what's going on, and making sure our digestive health, that we're having daily bowel movements, at least one. The ideal is 1 to 3 a day. I know for some people, they're like, oh my God, how is that possible? So When we can slowly increase our fiber tolerance, it's certainly possible, but you definitely want to be having at least one bowel movement a day. And then toxin avoidance. What I love about working with toxins, especially when you do testing for it, is the testing will show you in real time what toxins you're exposed to. So you don't have to guess, because it becomes very difficult to avoid like everything that's toxic because we use shampoos and conditioners and personal care products and makeup, and we drive cars that are on highways with exhaust. Like it gets to be a lot. And the toxin test will tell you, are you being exposed to a high level of parabens? Then we can narrow down what the focus needs to be. Are you exposed to a high level of BPA? Okay, great. Now I need to know like what cans are we using? Are there plastic water bottles? It helps narrow down the focus a little bit more. But in general, plastics are definitely not your friend, especially if you're heating them up in any capacity. So I'm even careful about putting like warm things in blenders that have like either they're a plastic blender, like the side is plastic, or even like the tops are plastic. If you're using plastic containers, making sure you're not washing them with really hot water or you're putting hot food into them. Plastic is better at room temperatures or colder things. That tends to be actually like pretty okay, especially if they're like a lower fat food. But when you get into anything that's high fat or acidic, those chemicals transfer really easily. So especially being careful with like canned food items, like canned tomatoes tend to be the worst because they're super acidic. But even things that are like super high fat, like a canned coconut milk, even sometimes too, like I'm not buying those in excess because that fat transfer is really real. So that's something to think about in terms of toxins. But then you can go into like, you want to make sure you're using non-toxic cleaning products, and even something as simple as like opening your windows every once in a while to get clean, fresh air in, taking your shoes off at the door, creating a really healthy home. And that's something we're going to have more on the community going forward. And then energetic rebalancing. This is like the part that I just absolutely love talking about with a background in Chinese medicine. So there's a couple of different ways to look at it. Energetically, we're dealing with, this isn't necessarily Chinese medicine. It's the chakra-based system, but the second chakra, which really develops between 6 months and 2 years old. So if we think about like what we're doing at that time, it's the first time in our lives that we're beginning to differentiate between self and not self. And it starts to be clear, like what is mine and what is not, what feels like pleasure, what feels like pain. We start to have the separation from like the oneness of the only thing we know into duality. And sometimes when there is a picture like PCOS, we start to think about, where did we learn that something was right or wrong? Did we learn that pleasure wasn't okay? That's a big second chakra theme. Did we learn that something wasn't in fact mine? Is receiving difficult for us? And then sometimes there can be underlying issues there around creativity, which tends to be a stuck energy of frustration, especially in Chinese medicine. So oftentimes people with PCOS, I really want to encourage them to have some kind of creative outlet. Start drawing, start cooking, start doing something that feels really free flowing, and you're tapping into more of a feminine energy, which is very creative. It's very flowing. It's very expansive, very powerful as a part of the healing process of PCOS, because sometimes that energy can feel quite stuck. And then sometimes there's an issue with boundaries, because when we start to differentiate between self and not self, sometimes that gets confused. So working with boundaries and understanding, what is mine, what is not, what is pleasure, what is pain, what is good versus bad, and understanding these parts within ourselves and that those are highly individual, can be a really healing, energetic rebalancing of PCOS. Does that make sense to everyone?
Yes.
Okay.
By the way, I just figured out the noise, Maddie.
Oh, what is it?
Fireworks. There
Oh,
are fireworks in Boston right now. I don't know why,
who would have thought that?
but
That's so
there
crazy.
are, and I can actually really see them.
Oh
And
my
it's
gosh,
like, it's
crazy.
like, you
Crazy.
guys hear it. But I was trying to figure out for the past 5 minutes. I was like, I feel my cortisol is spiking. What is
Oh my
happening?
gosh, not the cortisol. No. Oh, it's so
I
funny.
know, definitely.
No one
Now
was.
I know what it does.
Oh my gosh, too funny. Um, and then the last but not least, supplements. So some supplements can be helpful with a PCOS like picture. And it kind of depends on where you're at with the PCOS journey. And so I don't sometimes something like inositol can be really helpful. That tends to help with ovulation specifically. If we're looking at blood sugar regulation, supplements like berberine can be really helpful. Cinnamon, especially Ceylon cinnamon, can be really, really helpful. Antioxidants like potentially omegas, alpha lipoic acid can be helpful. Nutrient deficiency. So we got to know like what's your zinc, what's your magnesium, what's your vitamin D, and if those need to be optimized or not, because they all play a really huge role in hormone regulation. And then they do make some really amazing testosterone reduction supplements that have things like soft mento and stinging nettles and reishi. So that can be really helpful. Um, and then looking at things like if there's estrogen dominance, the supplement DIM that helps bind excess estrogen out through the bowel movements. And sometimes more adrenal-based supplements can be helpful, like adaptogenic herbs. I love them for helping regulate cortisol when necessary if the lifestyle interventions aren't enough. And there's other therapies that work. Acupuncture actually works really well with PCOS. Thinking about potentially red light therapy, like over the ovaries to enhance egg quality potentially. And energy medicine, yeah, whether it's acupuncture, Reiki, tends to actually be like really, really effective in helping with PCOS symptoms because it helps women connect into this area within themselves that they may be a little bit disconnected from, whether that's emotionally or potentially from something like birth control. So that's all I have. If anyone has any questions, I'd be happy to answer them.
I don't really have any questions, but I do really appreciate all the information.
Yay.
Being just
Oh.
like a reminder. It's always good, I think, to get reminders of like what our hormones are doing and what you can do, because sometimes one gets sidetracked or goes down a particular path and ends up with little bit blinders.
Yep.
And yeah, so I think that was really good. And yeah, thank you.
Oh, you're so welcome. Our hormone health is so interesting because our hormones, our hormones are so reactionary and they never work in isolation. It's like this crazy intricate web. And when we start to look at it in like the greater context, we're like, oh, okay. Like we start to see how things can become unbalanced. When we look at
And all these other, like the reminder of signs, right? Like I kind of laughed, or didn't laugh, but was reminded of clients and athletes from my past. Yeah, sorry, I need to be finished. I need to go. So thank you.
Bye. Have a
guys,
good night. Thanks.
bye.
amazing.
Oh, thanks, Elise. Also, you have to hop off. Thank
Thank
you.
you so much.
You're so
Yes, I'll talk with you guys
Safe
soon.
travels.
Yes, yes. Safe travels tomorrow.
Oh, thank you. I appreciate it. And thank you so much for taking the time tonight.
Oh my gosh, absolutely. I'll see you soon.
Bye.
And I will see you soon, Maddie.